Hello, my name is Jillian Sutton. I have played soccer for 17 years and I'm currently a collegiate athlete. Today I'm going to be talking about mental health in collegiate athletes and why the system needs to change. Many athletes feel that mental health in college athletes is undervalued and is not of high enough concern. I am inclined to agree with this opinion. In the words of Dr. Brian Hainline, the NCAA's chief and medical officer, stated, "Mental health is the single most important health and safety issue facing our student athletes today." 69.7% of student athletes reported having experienced a mental illness. According to an NCAA survey of 37,000 student athletes that was conducted in 2020, mental health concerns were 150 to 250% higher than historically reported. 1 in 12 athletes report feeling so depressed that it was difficult for them to function either constantly or most every day. In another survey conducted by the NCAA in the fall of 2021 on female athletes, they found that 94% felt overwhelmed by everything they had to do. 88% felt mentally exhausted, and 36% felt so depressed that it was difficult for them to function. They also conducted a similar survey on male athletes. The results showed that 71% of male student athletes felt mentally exhausted, 43% felt very lonely, and 38% felt hopeless. When asking these collegiate athletes what the top factors were that were negatively impacting their mental health, the results showed that 44% was due to academic worries, 37% was due to planning for the future, and 26% was due to financial worries. 85% of all collegiate athletes reported feeling very lonely within the last 12 months. In the survey conducted by the NCAA, it was also discovered that 34% of student athletes indicate that sleep difficulties resulted in a lower grade on an exam or test, and an additional 13% reported it resulted in a lower grade in their course. According to Athletes for Hope, approximately half of student athletes reported having depression, anxiety, or an eating disorder, but were too scared to tell anyone or seek help for their mental health. Only 10% of student athletes seek help for their mental health concerns. Things need to change in order to help these collegiate athletes. Mental health has been a taboo topic for a long time, and it is even further stigmatized in college athletes. Athletes are scared to go to their athletic department and coaching staff in order to get help. College athletic departments need to go further to ensure that athletes know it is okay to ask for help. With this, I believe that athletes should have some form of mental health counseling. Due to the stigma, many do not want to seek help. But by mandating counseling, it would allow for people to express their concerns without fear of repercussion. One of the top concerns for athletes was due to managing their sport and academics. When teachers and coaches work together to find a suitable schedule and decide what the student athlete is needed at and not needed at, would relieve a large amount of the stress. The staff at most colleges do not communicate very well, and this leads to athletes having to sort out everything. With this all decided ahead by the staff, the athlete would have less concerns and less to stress about. According to Dr. Seiko, a sports psychologist from Cleveland Clinic, the best way to help the problem is open conversations and an acknowledgement that mental health needs to be a priority. There should also be a higher priority when taking care of mental health in athletes. The Jed Foundation recommends that college athletes find their people, find their professionals, take control of social media, and explore what is important to them. Implementing these plans and solutions would have many benefits. Some of these include improved academics, there would be less use of illicit drugs and alcohol, suicide rates would decrease, improved athletic performance, and overall improved well-being of collegiate athletes. This could also improve self-confidence and allow for people to discover their passions. This could also lead to discovering a career path, getting a job, or simply finding a hobby. Robin Schofield, University of South California's sports psychologist, stated, "With a performance-based identity, if you aren't achieving, you don't perceive yourself as having value. Then when you do achieve something, it may be experienced as relief more than joy." Nicole Mendez, two-time NCAA softball champion and Olympian, said, As athletes, you know you will never be perfect, but you will die trying to climb that hill to reach perfection. This is the atmosphere in college athletics, and with this, it is no surprise that this causes poor mental health. This atmosphere needs to change in order to better the lives and mental health of these student athletes. Thank you.